But right now, let's turn things over to Mary.
All right, thanks a lot, Agnes. Well, when people feel pain in their backs or their necks, one of the things that immediately comes to mind is to pay a visit to their chiropractor. Dr. Joseph Kulaga with the Center for Chiropractic and Rehabilitation joins us this morning to talk about a number of other aches and pains that can also be treated by your chiropractor. And I think a lot of us always think, well, I strained my back, I picked something up funny, now's the time to go. But there are a lot of other things that can be treated by visiting your chiropractor.
Absolutely. Now, of course, we do treat spinal conditions like, related to the back or the neck, like muscle spasms, herniated disc. We also have sprained strains or whiplash, and also sciatica. But a lot of people might not be aware that we also treat extremities like of the arms and legs. Also, like people that come in with shoulder pain or like mild to moderate rotator cuff injuries. Also, hip problems like hip pain, hip sprain strain, and also bursitis. And I also have quite a few patients that come in that are runners or athletes that also come in with IT band syndrome and also foot problems like plantar fasciitis.
Okay.
And also we do see quite a few patients coming in, especially with this time of the year with stress. We get a lot of patients also with coming in with headaches as well. And they also have, of course, there's different types of headaches, and one of them definitely is tension headaches, and we treat a lot of that. And especially with chiropractic care, we can definitely help alleviate some of these symptoms.
Okay, is that because everything is related to the spine? Everything kind of starts there?
Absolutely.
Is that why we get those pains everywhere in the
yes,
body?
Absolutely.
All right, so once you treat the back, you kind of fix the other problems
Exactly.
as well. All right.
And everything else kind of falls into place.
The thigh bone's connected to the knee bone, kind
Exactly.
of a theory there as well. So how do you treat these conditions when people come to see you? Is it all, we think about cracking the back when we think about chiropractors. Is that what you actually do?
Well, we have a state-of-the-art facility at the Center for Chiropractic and Rehabilitation to also help with maximizing the quality of care for the patient. And we have several therapies that we can use. One of them is, of course, spinal decompression. What that is, it's really effective for patients with herniated disc. It's going to help take the pressure off the spine, help alleviate some of the pain. Also, we have therapeutic exercises and rehabilitation that is also very effective for strengthening the muscles of the spine and increasing flexibility. We offer laser therapy, also therapeutic massage, and electrical muscle stimulation. And of course, also the most important is spinal manipulation, or what most people refer to as the adjustment.
Okay. And so it's not all just about adjustments. There are many other treatments that
Absolutely.
you do as well that are going to take part in healing that person, getting them feeling better.
Exactly.
So if someone has something like an arthritis or a problem in their back where they think that the manipulation is not going to help, you have other treatment options that are not just the manipulation.
Exactly.
Okay. So definitely get out there and just talk to them and let them see what they have to offer you. Now, I know a lot of people are athletes in this community, and especially when it gets colder and they're not warming up right, you get a lot of sports-related injuries. Those can also be very well treated by a chiropractor.
Absolutely.
All right.
Of course, this is one thing I have a true passion for, is, I believe patients and also individuals should live an active and healthy lifestyle. Now, of course, I do treat patients with sports injuries as well as those that are non-sports related. But I do take a sports-specific approach with each individual patient that comes to the door, and to also help get them on a plan to help us put them on a specific plan to make them get a lot better, faster.
Right. And that way you're not going to re-injure and keep
Absolutely.
re-injuring. All right. If you'd like to see Dr. Kulaga, you can definitely call the Center for Chiropractic and Rehabilitation. He can meet with you and tell you what he can do to make you feel better. Thanks for coming in.
Thank you.
Well, coming